Hi, everybody. Thank you for joining us today for our medical weight loss webinar featuring Dr. Karrie Hohn. My name is Kim Sella. I'm a navigator at Palm Health, and I'll be here throughout and at the end to answer any questions and tell you how to get started if you are interested. So at this point, I'm going to turn it over to Dr. Hohn, and I hope you all enjoy our webinar.
All right, thanks, Kim. I'm going to share a screen and grab the slides for us. Give me just a minute to pull that up. All righty, so my name is Dr. Karrie Hohn. I am a family medicine physician, also functional medicine here at Palm Health, and we are going to talk about the medical weight loss program. So if you're not familiar with Palm, we're located in Ladue in the old Bushes Grove building. And it has undergone quite a change if you haven't been here since then. About 7 years, Palm came in and did a renovation. And we have currently a medical office featuring functional medicine physicians, cardiology, neurology. We have nurse practitioners, physician assistants. We have chiropractors. We have estheticians in our spa. We also have a gym with personal trainers, and we have a cafe with amazing food. Basically, it's an organization that's built to help you achieve your best well-being and to maintain that. And there are just so many health professionals here that will help support you along the way. So we developed a medical weight loss team because we saw this was becoming a need in the area. The members of this team are Dr. Sita Kadia, myself, our physician assistant, Katie Chambers, and our dietitian, Christine Townsend. I'll move this out of my way so I can read. Whoops, sorry. So you may have heard about medical weight loss. I know lots of people have. It's on the TV, it's on the news. There are several drugs that have come to the market in the last couple of years. One is semaglutide. It goes by the name, three names actually. It goes by Ozempic, Rybelsus, and Wegovy. There's another medication called tirzepatide. It goes by the name Mounjaro. And if you've watched any primetime TV, you've probably seen commercials for those meds. These medications work, and they're very, very effective. They work by decreasing your appetite, slowing your stomach emptying, and improving your metabolism. What we have found, and what I firmly believe, is that these medications are very effective at weight loss, but they can also cause issues if there isn't a lot of support and careful maintenance while they're being used. The idea, I think, in medicine is to do no harm and to create well-being for our patients. And the way to do that is to take a whole lifestyle approach. Just taking one medication, an injectable medication like Mounjaro or Ozempic, will help you lose weight, but it's not guaranteed to help you lose weight safely. Lose it in a way that you'll be able to maintain your muscle, lose your fat, and then come off of the medication and stay off of the medications over time and maintain a long-term weight loss. So that is our goal here at Palm. And we realized very early when we started using these meds that we were going to need support as providers, and that our patients were going to need support so that they could safely use these medications and achieve their goals. So what do? We first assess our patients. We bring them in and we learn all about the patient so that we can support them and so that we can offer them accountability. We give them medications to use so that they can get that little boost that they need to lose weight. And then we help them all along the way with lifestyle changes, diet changes, exercise changes, detoxification, so that they can have that effective long-term weight loss that they're hoping for. So the medications are Ozempic or semaglutide and tirzepatide. We'll meet with you and determine which of those medications is going to be best for you. we'll give you instructions on exactly how to use them. We'll help you get the med, and then we'll show you how to dose it, how to safely administer it. And then we're going to watch you very closely for side effects. We're going to help you find out, how to take it and what the best way is to avoid side effects. And if you do have side effects, how to avoid them. So diet and lifestyle change is really important when you're trying to lose weight. And I like to compare weight loss. In some ways, it mirrors very well diabetes. I have some diabetic patients who do not need medicines. They just learn how to eat well, they exercise well, and they are able to maintain their blood sugar on their own. That's great. I have other diabetics who are not able to maintain their weight or their blood sugar without medications. And I find that the same thing is true with patients who are trying to lose weight loss. Some patients try absolutely everything and they aren't able. And so those are the patients that require help with medication for weight loss. But it doesn't mean that they don't need to do the lifestyle changes. So we help our patients figure out what type of nutrition is best for them, what type of exercise is best. How do we manage stress? Sometimes stress is just a root cause of I'm nervous and going to eat. So how can we manage that stress? How can we also detoxify? What are ways that we can support our patients so that they can naturally maintain some weight loss while we're giving them some medication? And that so that they would learn these lifestyle changes and then be able to continue to do those after they've met their goals. So we meet with our patients frequently, regular check-ins with Katie Chambers, our physician assistant, and then with Christine Townsend, our dietitian, just to help make sure, one diet doesn't fit all. Make sure that we have the right diet for the right person. We can get you connected to personal trainers to help you figure out what kind of exercise is going to work best. Or we might just be the cheerleader for you, saying, hey, exercise is really important. You may know what to do, but may have trouble actually doing it. So we're going to encourage you all along the way to do that. And then we're going to add other things that I feel like we are really unique at Palm with, sauna, lymphatic massage, our cryotherapy, other things that you can do to help detoxify, to really push this process along for you and give you all the resources you can use. So support and accountability, we're going to help you track your progress with weekly weigh-ins. We're going to watch the weight and make sure that you're not losing weight too quickly. I don't know about you, but I've been driving and I hear about, I won't say the name, but there's a weight loss company that says you can lose a half pound to a pound a day. That's not good. So that is not what we do at Palm. That's never what we want. We're hoping to lose about a pound a week, maybe a little bit more. We're worried, and I know medically that if you're losing a half a pound or a pound a day, that you are probably most definitely losing muscle, and that's not what we want to do. So we're going to track and make sure you're not losing weight too quickly, make sure that you're staying on track and losing weight. And then we're going to help you work through challenges if you have issues with taking the medication or issues with diet or issues with maintaining exercise. We're going to be there to support, help you problem solve, and maintain that healthy lifestyle. So what does the schedule look like? Initially, in that very first week, you're going to meet with Katie Chambers, our nurse physician assistant, and she's going to do an intake, and she's going to see what type of lifestyle issues, what may be standing in your way, what things you've tried before in terms of medications or lifestyle changes. She's going to help get you set up to do your blood work, and she's going to order a glucose monitor for you, and then give you kind of preliminary recommendations for that first week, things that you can do already before starting medication. In that second week, you'll come back, you'll do your blood work, so that we'll have a baseline set of labs, and you'll meet with our dietitian, Christine Townsend. And again, she's going to do a forensic review of your diet. What have you been eating? How is it working for you? When are you eating? When are you exercising? So she's going to help assess where you are. And I would venture to say that if you're coming to us for help, what you've been doing may not have been working. So we're going to help figure out what's going to be the best stuff for you to do, the best exercise, the best food. We're going to add that medication most likely, as long as everything looks good, but we want to have everything in place for you. One of the interesting things that we'll do in that second week is a body composition. And I feel like that is, it's a must for this program. With the body composition, you stand on a machine, and it will monitor your total weight and will check your height, but it's going to tell us what is your percentage of fat, what is your muscle mass in your body. And not only will it tell you what it is, it'll tell you where it is. So it's going to give us an indication of where your muscles are strong and where they may be weak. If you have overall good muscle mass, or perhaps your core is weak, so that we can direct your exercise a bit. It's going to tell us where your fat mass is. And if you have excess fat, it'll tell us where it is. Is it on the surface, like your hip and thighs, or is it more deep in your abdomen? Both of those types of fat are targeted a little bit differently. And so once we know, we can begin to kind of have a baseline, assess where we've started, and then we're going to continue to monitor that body composition over time so we can assess your success. Are we bringing down that fat mass? Are we maintaining or gaining the muscle mass? The other thing that that Kristine will do is she will look at your glucose monitor. And so we, along with our program, offer a glucose monitor. It's a small round disc. We send a prescription to the pharmacy. You pick it up in the mail, or you pick it up at the pharmacy, and then we'll help you, if you haven't already, put it on. It affixes to the side of your arm. We put a Band-Aid over the top, and then it will connect via Bluetooth with your telephone, your smartphone, and you'll be able to see at all times for 2 weeks what your blood sugar is. So you'll monitor your blood sugar after you've eaten to see how did you respond to a certain meal 1 hour after or 2 hours after. Each of us is different. So many of us will respond to the ice cream sundae with a high blood sugar. Not all of us will respond in the same way. Some of us will respond tremendously to pasta or fruit. And so it's really, really important to know we want to keep that blood sugar nice and steady, because the more steady the blood sugar is, the less insulin goes up and the less fat storage that happens and the less inflammation and the less aging. So it's a really neat tool that you'll have for about 2 weeks. It'll stay on your arm and you'll see your blood sugar the entire time, so that we can help you figure out which foods are best for you, which foods trigger you, and even interestingly, what order to eat your foods. And so I just think that is phenomenal. You'll have that for a couple of weeks, and you'll be able to ask Kristine, myself, Katie questions, if you have them, about how to interpret that data so that you can have your best diet, your optimal diet. In about the third week, you will meet with me. So you'll already have met with Katie, you'll have met with Kristine, and then I will review all of that data. I'll take a look at your labs. We can look at your blood glucose machine results. We'll look at your body composition, and I'll make sure that we are on the best possible track for you in terms of diet, stress, sleep, exercise, blood work, medication, etc. Beyond that, fourth week, you'll have another visit with Katie, again, to continue monitoring those same things, looking for side effects. And we do see side effects. We see some nausea, some heartburn sometimes a little diarrhea or constipation. We are very careful to monitor for severe and significant symptoms, which are exceedingly rare, but we are carefully monitoring for those. So week 5, we do a nutrition visit again with Kristine, and then subsequent weeks, you'll have either phone, email, text, or in-person visits with Katie as you continue on your journey. Let's see what else. Continued weigh-ins, etc., with each of those providers. And then when we get down to the 12th week, we're going to reassess. We're going to repeat those labs and make sure that liver function, kidney function continue to be good. We're also going to repeat your body composition. So we'll make sure the muscle mass is staying intact and that your fat mass is coming down. And if it's not, we're constantly tweaking, encouraging that you eat plenty of protein, that you are getting plenty of exercise, et cetera, because we want you to have long-term success. And the best way to ensure long-term success is that you're developing healthy habits along the way: diet, lifestyle, exercise, sleep, and that you're also continuing to maintain your muscle mass, because if you lose the muscle mass, it makes it really hard to come off meds and be successful. So I'm going to introduce again to you Kim Sella. She is one of our navigators. Here at Palm, we have several navigators who help our patients make the most of their time at Palm, that they're using the services that we provide, programs like our medical weight loss or the sauna, the cryo, etc. So thanks, Kim, for coming back.
Karrie. Karrie, I had a few questions come in.
Okay.
One was, if they do labs here, is that something that their insurance will cover?
Yes. So if somebody does blood work, well, we always do blood work because we want to have safety. So that's going to, just like any provider, we would write the order for the labs. We would do the labs through Quest, and then your insurance picks up the cost of those. It depends on your insurance, what type of coverage you would have, but it's not any esoteric labs. It's very basic blood work.
And then another question was, someone had tried one of the, like Mounjaro, and they didn't have good results. And so could they let you know that, and then you could hopefully prescribe the other one?
That's right.
Okay.
Yeah. So we're going to assess every patient when they come in, just to carefully tailor which med might be right for them. And I have had patients who have done really well on one med, but not so on the other. So we really can't, there isn't any way, any markers that we can use to tell who's going to tolerate which med. If we do have issues, and I would say the lion's share of the issues are nausea, heartburn, bloating. Those are the things, or diarrhea, constipation is what we see. We haven't had any significant issues, thankfully. Those are very rare. So if we're having minor side effects and it's not tolerable, then we move over and try the other med.
Gotcha. Okay. Yeah, so if anybody has questions, or they're wanting to do either a meet and greet with Katie, our PA, you can reach out to me and I can set it up. It's free of charge, and you can go in and talk to her about what your goals are, and she can let you know if you're going to be a good candidate, and she can get the ball rolling. So we would be happy to have you. I'm here every day, so you can feel free to call me. I think my phone number was on one of the screens, but I'm a navigator here, so I'd be happy to get you set up.
Yeah. And I would say we're careful at Palm. I have some patients who want to lose 5 pounds. This is not the med for somebody who wants to lose 5 pounds. This is more, you're thinking about losing 25 pounds, or you're in that category of obesity, clinical obesity, or you're in the overweight category, but you have other issues like high blood pressure, diabetes, heart disease. Those are really good reasons to get control of that weight. And we can really make big changes in someone's overall health. We can just really change the course by bringing that weight down and, preventing diabetes. I've had patients who have stopped blood pressure medicine because they no longer need it, have stopped cholesterol medicines because they no longer need it. And then when the time comes for the person to come off of the meds, we gently bring them down, we wean them off. So we are super careful about it, and it's not for everyone. So I just want to throw that out there.
Okay. I don't know if anybody else who's attending has questions. But I'm here all day, every day, 9 to 5. So if you think of anything, feel free to reach out. Happy to answer questions, and if I don't know the answer, I'll ask Dr. Hohn and get back to you.
Yeah, I don't see any further questions. So,
okay. Well, thanks for everybody. Thanks, Dr. Hohn.
All right. Thanks, Kim.
All right. See you later. Bye-bye.
Bye.